Hi everyone, Nick Gilpin here, infectious disease doctor and system director for infection prevention at Beaumont. It's been about a month since our last coronavirus update. Lots to unpack, so let's get into it. A question I'm commonly asked is, are masks helpful for coronavirus? And the answer is, if you're a healthcare provider that's caring for patients with suspected coronavirus infection, the answer is yes. But if you're a patient or someone who doesn't have any symptoms at all trying to prevent coronavirus, the answer is no. And the reason is that the general public are typically not trained in how to wear masks appropriately, and not wearing a mask appropriately can often lead you to touch your face, which can further lead to the spread of respiratory infections. So I'm also commonly asked what's driving this current fear of the coronavirus, particularly given that we often see respiratory infections this time of year. And the answer is in the uncertainty. When you think about flu, which is very common, and flu comes around every year and it will make hundreds of thousands of people sick, the flu is also very predictable. It typically comes around in December and January, and it hangs around for a few months, and then it burns itself out by April or May. The difference here is that we really don't know where coronavirus is going, and that uncertainty causes a lot of us some discomfort. The best precautions to take to prevent the spread of coronavirus or any respiratory virus are a couple things that you can do. First off, practice good respiratory etiquette. Cover your mouth when you cough or sneeze. Next, hand hygiene. Hand hygiene can be done in a couple different ways. First of all, you can use soap and water for 20 seconds, or you can use an approved alcohol-based hand sanitizer to kill germs. Next, when it comes to high traffic surfaces, there is some evidence that coronavirus and other respiratory viruses can spread on high traffic surfaces such as countertops, doorknobs, car keys, so it's good to use an approved household cleaner to clean those surfaces. The highest risk and most susceptible patients to coronavirus are the elderly and people with chronic medical conditions. Chronic medical conditions include heart disease, lung disease, and conditions that compromise the immune system. Based on preliminary case reports, children and infants seem to be at lower risk for coronavirus infection. Currently, Beaumont does have an infection control plan for all of our campuses, but there's a little bit of information that I'd like to share with the public as well. First of all, if you're sick, that is fever, respiratory symptoms, or cough, and you think that you require medical care, whether that's at your doctor's office or through an emergency center, you should help us out by contacting your doctor or the emergency center prior to your arrival so that we can prepare adequately. If you have more mild respiratory symptoms, like a mild cold or a mild case of the flu, and frankly you don't need to go to the doctor for those symptoms, our best advice right now is for you to stay home and practice common sense precautions and monitor your symptoms. If your symptoms should worsen, you should contact us before you come in so we can adequately prepare for your arrival. To get the most up-to-date information on coronavirus, we recommend you go to the CDC website or check with state and local health departments who also have websites set up to provide the most up-to-date information to the public. Also, we've pulled all these links together for you at beaumont.org/coronavirus. I started our last report by asking everyone to take a nice deep breath and stay relaxed, and I think that message still applies here. We need to not panic in the face of this virus. Hospitals and healthcare systems are still prepared to handle the threat, and information is changing rapidly, but Beaumont will do our best to keep you informed.